I had a conversation with one of my long-term patients last week. She had undergone breast conservation treatment about 10 years ago and was now seeing me for her routine follow-up in her survivorship. As many people would already know, breast conservation treatment, or BCT for short, involves the complete removal of cancer with a rim of normal breast tissue all around it, usually followed by radiotherapy. The alternative treatment is a mastectomy, or the surgical removal of the breast. This can be followed by reconstruction. Some women without high risk may choose to undergo bilateral mastectomy, also termed as double mastectomy with reconstruction. Back to my patient. For 10 years, she had no complaints about the outcome of her treatment. In fact, her husband commented that there was hardly any change in the appearance of her breast, in spite of the fact that about 7 centimeters of breast tissue had been removed as part of her surgical treatment. However, while on a routine surveillance check a week ago, she developed new findings on her mammogram. I explained that, if she recalled the processes she went through before, a biopsy would have to be performed to make a definitive diagnosis of the new finding that formed within her breast. The appearance suggested that the finding was likely a result of benign breast tissue changes. So I offered her the option of monitoring closely the behavior of this new finding with a repeat mammogram in a few months. The alternative of a breast biopsy was available to her if she wished. She looked at me after this short discussion and said that she wanted a double mastectomy with reconstruction. To be honest, I was a little taken aback. After 10 years of a great life following breast cancer treatment, she now wanted to have double mastectomy, also known medically as bilateral mastectomy, with reconstruction. I asked her why she wanted to undergo such a drastic operation after years of doing so well in her survivorship. She said she wanted peace of mind. Her family history had not changed in the last 10 years to place her at high risk, and she was fast approaching the age of 60. Considering these factors, I decided I would go through the data on the subject of double mastectomy with her, again. I probably already did so 10 years ago, but there was new evidence regarding double mastectomy that had emerged which I may not have shared. So I plan to discuss what I believe to be relevant data spanning a decade, until 2025. As mentioned earlier, my patient did not have a family history of breast cancer, which would have placed her at high risk of developing recurrence. Even if she was a BRCA1 or 2 mutation carrier, the authors of this article, published in 2014, state that with prophylactic contralateral mastectomy, no clear survival benefit has been demonstrated so far. Prophylactic contralateral mastectomy is the medical term for preventive mastectomy on the healthy breast not involved with cancer, at the same time when mastectomy is performed for the breast with cancer. More recently, in 2025, the Society of Surgical Oncology Breast Disease Site Working Group affirmed that the survival benefit for bilateral risk-reducing mastectomy is unclear for patients with elevated risk of breast cancer. For women who are not at high risk of breast cancer, this study published in 2014 showed that breast conservation resulted in better survival rates than mastectomy. In other words, more women who had breast conservation treatment are expected to live longer than those with mastectomy. I would have discussed this with my patient 10 years ago when she was first diagnosed with breast cancer. In 2012, there was also the publication of this article, which found that a significant proportion of women who underwent contralateral prophylactic mastectomy report problems or negative changes relating to quality of life, sexuality, and body image. I would have also discussed this with my patient 10 years ago. In addition to problems with quality of life and body image, it was noted that complication rates were higher for women who underwent double mastectomy with reconstruction when compared with those who underwent unilateral or single-sided mastectomy. Women who had bilateral mastectomy, with or without reconstruction, were noted to have complication rates of more than 11%. In comparison, women who underwent breast conservation surgery had a complication rate of 1.74%. We can therefore see that the risk of complications with breast conservation was reported to be much lower than for mastectomy. Because of the research findings demonstrating that double mastectomy results in higher complication rates for doubtful survival benefit, In 2016, concern was raised by this team of doctors led by Dr. Yao that with the increase in CPM trends, it was possible that patients are making uninformed and even harmful decisions. The harm suffered by women undergoing double mastectomy with reconstruction is not limited to surgical complications and quality of life issues in certain types of breast cancers. In 2023, it was found that double mastectomy was associated with significantly increased risk of breast cancer mortality compared to lumpectomy with radiation. I also shared with my patient that a panel of experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference stated that breast-conserving surgery and radiation therapy is usually the best treatment option. It has been known for many years that following treatment, about 1/4 of women who undergo CPM express treatment-related regret attributed to surgical therapy. This article exemplifies the journey of one patient who decided to undergo bilateral mastectomy with reconstruction against the advice of doctors from the Unit of General Surgery from the University of Sassari. She underwent her choice of operation at another center and then returned to the University Surgery Unit for wound care and post-operative oncological consultation. At the 1-year follow-up visit, the patient expressed an opinion that she had begun to doubt the necessity of having undergone a bilateral mastectomy and considered that breast-conserving surgery may have been preferable as the treatment option. Having presented these data in an extended consultation with my patient, she decided to take time to consider her options. If you were in her position, what would you do? Please comment below as to whether you would be prepared for an 11% risk of surgical complications, up to 50% chance of problems with quality of life and body image issues, in exchange for what may be referred to as peace of mind. As we saw in the article by Professor Fancellu, the patient who underwent a double mastectomy developed doubts about her surgical treatment a year after her surgery. I mentioned to my patient that this is a point of consideration if she truly wished to undergo a double mastectomy with reconstruction to reduce her chance of recurrence and new mammogram findings as we continue with surveillance. Thank you for staying until the end of the video. I'd like to hear from you in the comments section about what you would choose to do if you were in my patient's position. Would you opt for a delayed double mastectomy, or would you continue to undergo follow-up? By sharing your thoughts, you will be helping doctors communicate more effectively with their patients, and through that, you will be helping another patient as well. So I look forward to learning from you. I hope you will join me in my other videos on the subject of breast cancer surgery. Until we come together again, take care.